Do you have erectile dysfunction? Stay with this video until the end to learn step by step what you should do and change in your lifestyle and your relationship. You will learn which factors have been negatively affecting optimal sexual performance and thus be able to eliminate them from your life. You will understand the importance of implementing or recovering habits inherent to the male figure that have existed since ancient times and that have been affected in modern society, which play a crucial role in the well-being of man's sexuality. Although this video does not intend to address the treatment of erectile dysfunction due to more serious organic causes, where the degree of irreversibility is significant and revascularization surgery and penile prostheses constitute a life-saving option for these patients, as well as more serious erectile dysfunction due to psychogenic causes such as depression and psychosis, where the intervention of a professional in psychology and psychiatry is essential. We hope that you will learn how to gradually recover erectile function in those cases that constitute the majority where the degree of reversibility is greater, as well as how to prevent it in those who are not yet affected but are affected by certain modifiable or controllable risk factors. Do I want to regain my erectile function? This is the question you should ask yourself before you start, as you must change and eliminate negative habits that affect your overall health and sexual performance. Number 1. Smoking habit. Smoking can gradually and permanently damage blood vessels throughout the body, including those that carry blood to the penis. This can make it difficult to get or keep an erection. Quitting smoking can help prevent further damage from occurring within the blood vessels. Smoking can also affect a man's ability to get or keep an erection in other ways. Nicotine can cause blood vessels to narrow for a short time, making it harder for enough blood to get to the penis to achieve a normal erection. Men who quit smoking often have fewer problems achieving a normal erection. Number 2. Alcohol consumption. Chronic exposure to alcohol increases the oxidation state of one of the main proteins involved in erection, guanylate cyclase. When the protein is oxidized, it is less functional, and therefore the erection will be less severe. Alcohol causes an interruption of erection in men, regardless of the dose taken, since it delays, distorts, and slows down the perception and response of our senses such as reflexes, vision, hearing, and sexual response. Alcohol inhibits the proper functioning of the central nervous system, so if there is no correct communication between the stimuli, the brain, and the circulatory system, the arrival of blood to the penis is hindered, making penetration and intercourse difficult. Number 3. Drug use. Men who have been consumers of addictive substances have a higher percentage of erectile dysfunction than men who have not been consumers. Cannabis derivatives, marijuana, and hashish. Prolonged use can reduce testosterone levels and seminal fluid. Cocaine. Its regular use sometimes causes erectile dysfunction and priapism, painful and permanent erection, as well as a significant loss of sexual desire. Amphetamines. They cause insomnia, increased physical and intellectual performance, and great euphoria. However, they cause a rebound effect, preventing men from maintaining an erection for several hours. Heroin. There is inhibition of orgasm and ejaculation, inhibited sexual desire, and erectile failure in men. Diabetes mellitus. It is the endocrine disease most frequently associated with erectile dysfunction. The probability is 3 times higher than that of the general population. 25%, 75%. 15% of healthy men with erectile dysfunction have an altered glucose overload. The etiologic mechanisms involved in the development of erectile dysfunction in diabetics would be vascular, neuropathic, and due to gonadal dysfunction. Cardiovascular disease. Several epidemiological studies have shown an association between the presence of heart disease, high blood pressure, HBP, peripheral vascular disease, and decreased HDL cholesterol with erectile dysfunction. Good control of chronic diseases prevents irreversible damage to erectile function. Whenever possible, avoid drugs in the treatment of chronic diseases that affect sexuality, and specifically erectile function in any way. Here is a list of the main drugs related to erectile dysfunction. Consult your doctor to agree on a change of drug if possible. Step 3. Reduce excess weight. Combat obesity. Obesity can affect blood circulation. Excess weight can increase blood pressure and cholesterol, which can limit blood flow to the blood vessels of the penis and make it difficult to get an erection. Obesity can affect testosterone production. Abdominal fat produces an enzyme that converts testosterone into estrogen, which can reduce testosterone production and affect sexual function. Obesity can affect sleep quality. Sleep disorders, such as sleep apnea, are more common in people with obesity. Lack of adequate sleep can affect sexual function and libido. Eliminating a sedentary lifestyle and starting an exercise regimen selected by a trainer according to your body weight, physical condition, and underlying pathologies is crucial to the progressive recovery of erectile function. Excess body fat can lead to endothelial dysfunction, which is when blood vessels don't function properly. This can affect the body's ability to produce nitric oxide, a chemical needed to achieve and maintain an erection. Obesity can reduce testosterone levels in the body. Testosterone is the male sex hormone that plays a key role in sexual function. When testosterone levels are low, it can be more difficult to get and maintain an erection. Step 4. Implement a healthy diet. An unhealthy diet high in saturated fats and processed carbohydrates linked to a sedentary lifestyle can contribute to obesity, insulin resistance, and inflammation, which can affect sexual function. On the other hand, a diet rich in fruits, vegetables, lean proteins, and healthy fats can improve cardiovascular function, metabolic health, and sexual function. Consume potentially aphrodisiac foods such as oysters, due to their high zinc content, which activates testosterone production. Nuts. They have large amounts of omega-3 fatty acids, minerals, and vitamins. Cashews and almonds for their high zinc content. Chile increases and promotes blood circulation and the production of endorphins. Also, hot peppers, ginger, and Tabasco sauce are rich in capsaicin, a substance related to the release of pleasure hormones. Watermelon. The reason for this action lies in a substance it contains, citrulline, which has been shown to have positive effects in cases of mild erectile dysfunction. Blackberries. This is due to their high content of phytochemicals, substances that not only improve desire but also sexual performance. Others, such as garlic, banana, and chocolate, are also beneficial for sexual health. Step 5. Increase testosterone levels naturally. Testosterone is the main male sex hormone. There are many ways to help increase testosterone, including diet and exercise. 1. Exercise and weightlifting. Exercise is one of the most effective ways to prevent many lifestyle-related diseases. Interestingly, it can also help in increasing testosterone. Resistance training, such as weightlifting, is the best type of short and long-term exercise for increasing testosterone. Consuming caffeine and creatine monohydrate as dietary supplements can further increase your levels when combined with a training program. 1. Eat protein, fat, and carbs. What you eat has a huge impact on testosterone and other hormone levels. Therefore, you need to pay attention to your long-term calorie intake and strategize your diet. Eating enough protein can help maintain healthy levels and aid in fat loss, which is also associated with your testosterone. Carbohydrate intake also plays an important role, with research showing that carbohydrates can help optimize testosterone levels during resistance training. Research shows that the right amount of healthy fats are also beneficial for testosterone and health. Fats like those found in cod and shark liver oils are high in vitamin D, essential for maintaining your testosterone. A diet based primarily on whole foods, with a healthy balance of fats, proteins, and carbohydrates, is best. This can optimize both hormone levels and long-term health. 1. Minimize stress and cortisol levels. Research is always highlighting the long-term dangers of stress, which can elevate levels of the hormone cortisol. Unnatural increases in cortisol can quickly reduce testosterone. These hormones work in opposite proportions. As one goes up, the other goes down. For optimal health and hormone levels, you should try to reduce stressful and repetitive situations in your life. Focus on a whole foods-based diet, regular exercise, good sleep, positivity, and a balanced lifestyle, all of which can reduce stress and improve your health and testosterone levels. 1. Get some sunshine or a vitamin D supplement. Despite its importance, nearly half of the US population is deficient in vitamin D, and an even larger percentage has suboptimal levels. To increase testosterone and obtain the other benefits of vitamin D, try to expose yourself regularly to sunlight. Exposure should not exceed 1 hour, always without as much clothing as possible, thus increasing the benefited body surface area, and at times when the sun's rays hit as close to perpendicular as possible, or take around 3000 IU of a vitamin D3 supplement per day. 1. Get the right amount of sleep each day and make sure it's high-quality. 1 study found that for every additional hour of sleep, testosterone levels increase by an average of 15%. Although some people seem to do just fine with less sleep, research suggests that getting 7 to 10 hours of sleep a night is best for your long-term health and your testosterone. 1. Get in touch with nature. Walking barefoot on grass, rocks, sand, on reefs, swimming, running on natural terrain, climbing hills, practicing combat sports, and exposing yourself to the sun are activities that will help you significantly in maintaining optimal levels of testosterone that favor good sexual performance. Step 6. Have sex. It is very important to understand that despite having had one or more negative experiences in previous sexual encounters where a satisfactory erection was not achieved, one should not abandon sexual practices for fear of failing again. And this is where the partner plays a fundamental role in understanding first and unconditional support later. Taking into account that sexual pleasure and orgasm are not necessarily achieved solely through penetration, but that there are different sexual techniques or practices that are just as pleasurable as penetration, and that keep the couple engaged in sexual activity. This would help monitor the recovery of the erection that sexual abstinence would not provide, plunging the patient into even greater depression. It is necessary to recreate environments where privacy is guaranteed, adequate temperature, use of erotic clothing, makeup, hair arrangements, activating known sexual fantasies, as well as supporting oneself with sexual toys and erotic attitudes that exacerbate sexual stimulation. If the patient does not have a sexual partner or has lost one, he or she can use masturbation under the same conditions. Contrary to an erroneous myth with no scientific basis, masturbation does not cause erectile dysfunction, nor is it pathological for a man's sexuality. Furthermore, masturbation does not involve any type of mental or physical problem and is very useful when used as a medical therapy for various sexual pathologies such as erectile dysfunction, premature ejaculation, lack of penile sensitivity, penile curvatures, recovery of patients operated on for prostate pathology, penile fibrosis, Peyronie's disease. Eliminating the habit of smoking from your life, reducing alcohol consumption to a minimum or completely, removing drugs from your life, controlling chronic diseases such as diabetes mellitus, replacing those medications in the treatment of these diseases that affect sexuality and erectile function with others that are equally effective but do not negatively affect the sexual sphere, combating overweight and obesity, draw up a healthy diet, balanced in proteins, fats, and carbohydrates according to the physical activity that you should implement fundamentally with weight training, sunbathing regularly or taking a vitamin D3 supplement as necessary, incorporate ancestral habits of man with caution, such as interaction with nature, walking barefoot on grass or on rocks, swimming, fishing, hunting, climbing, practicing combat sports. According to your physical condition, age or underlying pathologies allow it, maintaining sexual activity and ruling out abstinence. The majority of cases where there is no irreversible damage will manage to recover their erectile function partially or totally in around 6 months. During this time, your doctor will support you with first-line treatment with oral medications, vacuum devices, and constrictor rings without resorting to more invasive second-line treatments such as intracavernous injection of vasoactive medications such as papaverine, phentolamine, and alprostadil. Selective phosphodiesterase 5, PDE5, inhibitors such as sildenafil citrate, Viagra registered trademark, tadalafil, Cialis registered trademark, with a faster and longer-lasting effect than the former, and vardenafil, Levitra registered trademark. Sildenafil enhances the natural effects of nitric oxide on the smooth muscle of the cavernous arteries and sinusoids. These drugs are orally active peripheral conditioning agents that facilitate natural responses to sexual stimulation through their effects on the effector organ, the penis. The aim of symptomatic treatment of these oral drugs is not to use them permanently, but to support you physically and mentally on the road to definitive recovery. In most successful cases, it is the patients themselves who tell you that they no longer need the drug. Selective phosphodiesterase 5, PDE5 inhibitors are absolutely contraindicated in men who use nitrates for cardiovascular disease. If you like our content, give us a like, subscribe, activate the bell, and share this video so more people can see it.